Hi there, Grant Blashki from familydoctor.expert. Today we're going to talk about Parkinson's disease. Actually, it's Parkinson's Day on April 11th, and it's very important for people to know about this condition. It actually affects 6 million people around the world and more than 70,000 Australians. And it's a neurological condition that affects movement. And we think that it's to do with a brain chemical called dopamine, which is very important for the body's normal movement. And there's a small little part of your brain called the substantia nigra, and the nerves, the neurons, get depleted in this area and cause the disease. Now, we don't fully understand what causes it, though there are a few things. We know there's some genetic component, because 15% of people with Parkinson's disease have a relative with the disease also. But some environmental things can set it off. We know that it's more common amongst farmers. There's some pesticides which can cause it. There's even some drugs, a particular drug a few years ago called MDMA, a sort of a recreational drug, caused the illness in a whole lot of young people. So, what happens with Parkinson's disease? Well, there's four main sort of categories of symptoms that we look for. We look for tremor. Now, not everyone has it. About 30% of people don't have it, but what we call a resting tremor. So when the hand's at rest, for example, it has this shake. Second thing that we look for is rigidity, or what we often call lead pipe rigidity. So often the doctor will check your arm movements and see if it feels like a lead pipe. Another classic sign that the doctors talk about is cogwheel rigidity. So when they move your arm, it almost moves like a cogwheel. The next set of symptoms is what we call bradykinesia, or slowing, and this is a very common feature in Parkinson's disease. And the fourth symptom is postural instability, trouble walking, lots of falls. So this is the usual sort of set of symptoms we're looking for. Now, in making the diagnosis, you should be aware that there's not a specific test, so it's really a clinical diagnosis. As a GP, I always like to get a neurologist who's a specialist in brain problems to have a look and check the patient if that diagnosis is correct. There are some other similar conditions with complex names like supranuclear palsy and Lewy body disease, and even one called Parkinson's plus. But your neurologist will be up to date with all of these. Often the doctor will want to do some further tests to exclude any other diseases, such as a brain scan called a CT scan or an MRI. So what do you do if you have Parkinson's disease? Well, probably the first thing to do is to get informed about the condition. I recommend a really great website that's been set up by Parkinsons Australia, and it has some great fact sheets about all the common problems with Parkinson's disease. Now, it's important to stay hopeful. It can be a very stressful diagnosis, but it is usually a slowly progressing disease, and the rate at which it progresses varies between people. In fact, most people aren't going to die of their Parkinson's disease, but of something else. But it does tend to get worse over time. Now, there's a couple of good treatment approaches that we have. So the first step is to try and get a good team. So I recommend that you have a GP, that you have a specialist neurologist, and you should also be aware that there's some excellent allied health professionals, people such as dietitians, occupational therapists, physios, who specialise in Parkinson's disease, and they can be very helpful with the practical problems. Keeping a healthy lifestyle is very important. Exercise, regular exercise is useful, a healthy diet, maintaining good relationships, keeping up your work if you're currently working, or staying occupied if you're retired. Now, medications. I mentioned at the start that the main problem is the loss of this brain chemical called dopamine. So we're really trying to replace that. Now, usually at the time of diagnosis, they can't fix the problem. The little nerves, the neurons have actually died, they're depleted, but they can give you extra dopamine. So often the specialist with the assistance of the GP, will be trying to titrate these various classes of medicines to try and get the right level. So the main one is a medicine called L-DOPA, and it has a number of side effects which your doctor will be looking out for: low blood pressure, nausea, constipation, strong dreams, and if you take it for a long time, it actually can cause some quite serious long-term involuntary movements we call tardive dyskinesia. So it's very important that you work with your doctor on what's the right dose of this medicine. Another similar medicine group is called the DOPA agonists, and essentially they're stimulating the dopamine receptors in your body. Now they also can have some side effects, some particular ones to be aware of. They can trigger some sort of obsessive compulsive type behaviours and even some hypersexual type behaviours. So it's worth talking with your doctor if someone's on this medicine and is behaving right outside their usual way that they would. Another group are called the COMT inhibitors, C-O-M-T, and essentially they're trying to stop the breakdown of dopamine, and they've got their own set of side effects, including discoloured urine, which is actually harmless, but it's important people know about it. A couple of other groups, the Mayo inhibitors, they're actually used as antidepressants as well, but they can have side effects and they can interact with a range of medications, so your doctor will be watching them very carefully. The initial medicines we used before we had DOPA, but we use them still these days, are called the anticholinergics, and they have a range of side effects including dry mouth and sometimes urinary retention. So you can see there's a complex set of medications, very important to have a neurologist involved. Now, for some people, there are new surgical approaches, a particular approach called deep brain stimulation. It's not for everybody, but it can be very effective for some people. So what are the sort of common issues that people with Parkinson's disease have? They often spend a fair bit of time with their doctor trying to get the right doses right, to get the Parkinson's symptoms under control without having too many side effects. Other common problems are the emotional issues. It's a big stress having a disease like this, and a lot of people will get depressed, and so it's very important to speak with your doctor, maybe get a psychologist or a psychiatrist involved if this is necessary. Parkinson's can affect normal communication. Unfortunately, one of the effects of it is to affect the usual facial expressions, and it can also affect speech, causing a stutter-like syndrome we call festination. So there's lots we can do to help with this. Occupational therapists can work with you on facial expressions and these sort of things, so that can be important. Some people have swallowing problems, and this can affect if they're getting enough food. Some people have saliva issues, struggling to swallow and ending up with a lot of saliva. Sleep can be a problem for some people, turning around in bed. As the disease progresses, we're worried about falls, as it does affect balance, and so there's lots of things you can do with an occupational therapist and a physio to try and reduce the risk of falls. The eyes can be affected, sometimes dry eyes, sometimes double vision. Good idea to also have your eyes checked. So because there's quite a lot to do with Parkinson's disease, a little bit like a disease like diabetes, it's really good to have a long-term relationship with your GP. The GP is able to straddle many of these complex physical issues and mental issues, and importantly, hopefully provide continuity of care over a long time. They can also help coordinate a range of specialists and allied health workers. So Parkinson's disease is very common. It's really important to be aware of it. You may well have someone in your family or friendship group who suffers from the disease. Certainly in my family, we've had a couple of members unfortunately affected by the disease. But we do have some really good treatments to try and keep the disease at bay, and it's important to get a good team and to keep up a healthy lifestyle. Now, as usual, these videos are just for general advice, so don't make any medical decisions based on the videos. Very important to talk to your doctor about your specific medical circumstances. I wish you well from familydoctor.expert.